So the today's topic is on the liver disorders or the diseases of the liver and effects of the liver disorders on the body. So here we got our MBBS students from the Malacca Manipal Medical College. So I would like you to introduce yourself one by one. Yes, can you introduce?
Okay, my name is Kim Chubing. I'm from B33 from Malacca Manipal Medical College.
Yes.
And I'm Mahindri, same batch. I'm Nazrina, also from the same batch.
I'm Hakim from Cirrhosis batch.
Okay. And I am Prof. Bashir, right? Who is the coordinator of this session. So, since we are talking about the liver diseases, right? And we know that different diseases can affect the liver. The common ones are the hepatitis, the viral hepatitis. And hepatitis can happen due to the bacteria, it can happen due to fungal infections, or it can happen due to rickettsial infections. And the liver can also get affected by, as I said, due to hepatotoxic drugs. If we take poisons or if we take antipsychotic drugs, tranquilizers, sedatives, then they can damage the liver if patient is hypersensitive. Similarly, the liver can get damaged. Very often we see that people who are chronic alcoholics, their liver is mostly damaged, which results in alcoholic cirrhosis. Similarly, multi-system diseases, the collagen vascular diseases like systemic lupus erythematosus, rheumatoid arthritis, because of antigen-antibody activity, they can damage the liver. Similarly, the other multi-system diseases like AIDS or like leukemias or malignancies anywhere in the body which can metastasize in the liver and damage the liver. And there are so many congenital conditions where the patient's liver is where the patient will have some deficiency of the enzymes, as happens in the newborn babies and children, that they got so many enzymes. So we got so many syndromes like Crigler-Najjar syndrome, Dubin-Johnson syndrome, isn't it? So congenital disease also can cause the damage to the liver. And when we are talking about the diseases of the liver, so when I say that different diseases damage the liver, I mean to say that any disease can cause injury to the liver. Any disease. The ones which I just narrated, what are this thing? They can damage this thing. Now the symptoms will depend whether the damage is mild to moderate or whether it is severe. If it is mild to moderate, you may have very few symptoms. But if it is moderate to severe damage, then you can have almost all the symptoms of the liver disease. Almost all signs of the liver disease. And ultimately, when there is a severe damage of the liver, it will result in hepatic failure. So all these diseases that I mentioned ultimately will cause the decrease in the function of the liver. So functions of the liver will be lost, with the result we see that now patient is in failure. He can't perform the normal functions of the liver. And when patient has got a hepatic failure, it has got then different symptoms, like it can go into coma, person can be stuporous, person can be inattentive, he may become drowsy, and so many other things. So, would you please tell me what are the signs and symptoms of the liver disease?
So, I first start.
The only thing I would like to say, you please say it loudly. Yes.
So I'll first start off with the symptoms. So the first symptom can be jaundice due to hyperbilirubinemia, and then secondly, liver disease can also result in symptoms like abdominal distension or pedal edema. The patient can also have symptoms like nausea, vomiting, loss of appetite, abdominal pain, pruritus, fever in case of hepatitis, decreased sexual desire or impotence, bleeding tendency, blindness or any bony pain due to defective absorption of the vitamins A, D, E and K, and also symptoms of anemia like fatigue, dyspnea, palpitation, and sometimes due to the liver disease causing increased portal pressure, the patient can even have symptoms like hepatitis or melena. And moving on to the signs. Signs is something that we elicit. So when we examine the patient, like for example the vitals, okay, we can see that there's an increase in temperature in case of like hepatitis or any spontaneous bacterial peritonitis. And for the nails and hands, we can elicit signs like leukonia. We can see signs like leukonia, clubbing, palmar erythema, deputans contraction, flapping tremor, any bruise marks.
So flapping tremor will be when the patient is going into hepatic encephalopathy, then we see that patient has got the flapping tremors, which happens in the hepatic encephalopathy. Yes.
Okay. So that's for nails and hands. Then for eyes, we can see the icterus, okay, in the lower subconjunctival.
So on the conjunctiva, it is not. It is all over the sclera, isn't it? That we will have what is called as the jaundice. You understand?
Yes.
Yes.
And in case of anemia, you can see pallor in the sclera. In case of Wilson's disease,
pallor in the conjunctiva.
In the conjunctiva. In case of Wilson's disease, K-ear fleshes ring. In case of vitamin A deficiency, you can even expect a Victor spot. That's for the eyes. Moving on to the face. In case of alcohol abuse, we can expect parotid enlargement on both sides, fetal hepaticus, in those that goes for like say hepatic encephalopathy. Then for the skin, you can see signs like spider nevi, scratch marks, skin pigmentation.
The spider nevi is the dilatation of the arteriole. Usually we don't see the arteriole. The arteriole is not seen. You understand my point? But if the arteriole gets dilated, right, and then we can see it by the naked eye. You understand my point? So it will show the capillaries will be radiated. You understand the point? So it is the dilatation of the arteriole looking like a spider, right? So we call it as the spider nevi. Usually on the front of the chest we can see, or anywhere in the body.
Okay. Then we go on to the skin. In case of any malignancy, then we can expect lymphadenopathy, especially in the left supraclavicular node, which shows node. And for the chest, in male patient, the patient can have signs like gynecomastia due to raised estrogen levels, loss of axillary hair, and then moving on to the genitalia, males can even have signs like testicular atrophy. And
so that means the person is changing into a male person is changing into female characters, isn't it? His characters are changed. So this is because the liver detoxifies the hormones, right? And when liver is diseased, so detoxification of the hormones will not take place. With the result, there will be accumulation of the hormones, especially of the estrogen. With the result, there will be enlargement of the breast and testicular atrophy, right? The loss of hair, so changing into a feminine character. Yes.
And lastly, for the general examination, when you inspect the lower limbs, you can expect pedal edema and even hair loss in the lower limbs. So after that, we move on to systemic examination. Since it's concern of the liver, we do.
So before you just continue, you said that patient will have anemia, patient will have jaundice, isn't it? And the anemia as I said, that the anemia is because the liver is meant to store different vitamins. The most important is vitamin B12 and B complex vitamins like B1, B6, right? So these vitamins are essential for the synthesis of the blood cells, especially RBC. And we also know that liver also secretes some quantity of erythropoietin, and when there is a liver disease, so all these stores will be depleted. The iron will be depleted, as well as the vitamins will be depleted, erythropoietin will be depleted. With the result, all this will result in anemia, because these were the products which are used for the synthesis of RBCs or synthesis of the blood cells. That is why there will be bleeding. And another reason that there will be decrease in the RBCs. And another reason for anemia is that whenever there is a liver disease, the coagulation factors the coagulating factors will be lost. With the result, for example, the prothrombin will not be formed. The prothrombin is mainly formed in the liver. And there are other coagulating factors like factor 2nd, factor 7th, 9th, the 10th factor, and these factors are dependent on the vitamin K, right? And vitamin K, A, D, E, K are absorbed when bilirubin is secreted. So when bilirubin is not coming to the intestine, there is a damage in the liver. So the vitamin K will not be absorbed. So with the result, these coagulating factors will not be formed. So the person can bleed. Person can easily bleed. So the person having a liver disease can have epistaxis, melena, hematomesis, petechial hemorrhages. This may be also the cause for anemia, because person is bleeding. You understand my point? Yes. Can continue.
And for the signs that you can see in systemic examination, example the abdominal examination, you can see signs like distended abdomen, fullness of flank, caput medusae.
So this distension of abdomen, caput medusae, and distension of whole body is due to the gain of the water. There will be gain in the weight, and this weight increase will be because accumulation of water in the body. Because whenever there is protein loss, when the albumin is lost, because albumin is formed in the liver, so when person has got a liver disease, so albumin will not be formed. With the result, the oncotic pressure will decrease, so fluid will go into the interstitial cells, it will go into the skin, and there will be edema all over the body. That is why you are telling that person will have distension of abdomen, swelling of legs. This is all because of the fluid overload. And it may result in later it may result in the heart failure because of the fluid overload. Okay.
Then on palpation you can see signs of hepatosplenomegaly, and on percussion you can shifting dullness, fluid clearly can be positive. There can be dullness in drop space, increased liver span. And on auscultation, sometimes you can hear to hepatic buoy or any venous harm. And for like CNS examination, like if the patient is in hepatic encephalopathy stage, you can find that there is constructional apraxia, whereby you ask the patient to draw a star, but he won't be able to draw a star or draw a normal clock. And then there is memory impairment, decrease in intellectual function, he can't do any simple mathematical calculation.
So that is because the liver is actually the liver. When person has another function of liver is to convert the ammonia into urea, right? So when person has got a liver disease, his ammonia will not be converted into urea. So there will be accumulation of the ammonia. So such a patient can have ammonical breath. You understand my point? And ammonia is very much irritant to the nervous system. to the brain, and this can act as false neurotransmitter. So with the result that the patient will be confused, inattentive, loss of concentration, stuporous, drowsy, he can go into coma, he can become agitated. So in other words, his higher functions will be lost, his intelligence will be decreased, right? Then his behavior may change, he may become irritated. All these things can happen due to the accumulation of the ammonia, because ammonia as such is very deleterious to the brain cells. Right? Okay. Okay, so thank you very much. Okay, would you please tell me some of the diseases that can affect the liver or that can damage the liver?
Some of the different diseases of liver, it can be acute liver failure. It can be caused by infections. For example, it's the viral hepatitis, liver abscess, HIV infections, and the liver. Then there is also
the commonest what we see usually in the wards, what we see in day-to-day practice, we see usually the viral hepatitis. Most commonly the viral hepatitis. Hepatitis A, Hepatitis B, Hepatitis C, isn't it? For example, we see Hepatitis C when somebody is on hemodialysis or somebody has received blood transfusions. These patients are usually having the Hepatitis C. Similarly, if patient has got a chronic infection, we say, most probably it is the Hepatitis B. If the infection is only lasting for about a month or 1.5 months, then it is Hepatitis A, which is a waterborne disease. If patient doesn't maintain hygiene, doesn't take the clean water, then he has chances of developing the Hepatitis C. And Hepatitis B, those patients,
there can also be liver cirrhosis, portal hypertension. It can also be affected by chronic alcoholism, like alcoholic liver disease, and also non-alcoholic fatty liver disease. Other causes like autoimmune liver diseases, for example, like primary biliary cirrhosis, primary sclerosing cholangitis.
So primary biliary cirrhosis, the primary biliary cirrhosis usually happens in the young woman. The scenario will be, there will be young woman, right, and their liver will be enlarged. Usually we find that in cirrhosis the liver will be shrunken, but it is in primary biliary cirrhosis the liver is usually enlarged and happening in the young woman. If scenario is like that, then it could, one of the possibilities is primary biliary cirrhosis. And in primary biliary cirrhosis there will be severe jaundice and deep jaundice, and there will be itching also. So all these features will be there. Then we can suspect that that patient is having perhaps biliary cirrhosis, primary biliary cirrhosis. Yes, continue.
They may also have tumor of the liver, for example, benign or primary as well as from the other secondaries. The drugs also can induce liver injury. Other than that, it's like inherited liver disease, for example, hemochromatosis, Wilson disease, alpha-1 antitrypsin deficiency, Gilbert syndrome, and also there is other vascular liver diseases like hepatic artery disease, portal venous disease, hepatic venous diseases, nodular regenerative hyperplasia of the liver.
So these are some of the diseases. There is actually endless list. There are so many diseases or so many risk factors that can affect the liver. But the common ones are what you have just mentioned. And the result of all these diseases, as I said, is the hepatic failure. Somebody asks you what are the causes of hepatic encephalopathy, then you can mention all these causes. You understand my point? Somebody asks you what are the diseases that can result in malignancy. All these diseases can have got a predisposition to malignancy. They can change into malignancy. Somebody has got a somebody has got a disease of liver, then chances of occurring liver in those patients goes very high than in healthy people, isn't it? So we got a common disease like alcohol. Many times you have seen in the wards that people are having cirrhosis of liver, and when we take their history we find they are chronic alcoholics, isn't it? Or if a person, as I said, if a person is taking some drugs like antipsychotic drugs or sedatives or tranquilizers, or person is a drug addict, then it can damage the liver. What we call it as hepatotoxic drugs.
Infected individuals like newborn of infected mother or any regular sex partners, patients on chronic hemodialysis, patients with chronic, those in medical, nursing and also lab personnel.
Yes, because of needle pricks.
Needle pricks.
Yes.
IV drug users,
Yes.
Unscreened blood products, tattoos, unprotected sex, needle prick injury like cirrhosis, sharing razor blades or toothbrush, and contaminated vaccine needles like iatrogenic parental transmission.
So all these can lead to the hepatitis.
Yeah.
Like as we said that hepatitis B or hepatitis C, which can happen due to these risk factors. Yes.
And other than that, now it's quite famous non-alcoholic fatty liver disease.
Non-alcoholic fatty liver
disease. So the risk factors for this will be like all the metabolic syndrome like obesity, diabetes mellitus, hypertension, dyslipidemia.
So in diabetes there occurs the disturbance in the fat metabolism, right? There occurs the increase in the lipids. So with the result, these lipids will get deposited in the liver. That happens in the diabetes. Or person is a obese person who has got dyslipidemia or who got increased lipids in the blood, then these lipids can get deposited in the liver, so it will result in fatty liver. And fatty liver has got more chances to develop the cancer. Somebody has got a fatty liver, it can change into cancer. Is more prone to have cancer. And fatty liver, that means if somebody is having a fatty liver, he has to restrict the fats, isn't it? Otherwise, he has a tendency to go into hepatocellular carcinoma, or he may go into hepatic failure, or liver damage and hepatic failure. So these are the risk factors which can affect the liver.